What are uterine fibroids? Uterine fibroids, also called leiomas or myomas or fibromyoma, and they are the growths that appear in the uterus and are made of uterine muscle. Fibroids are most common in women in their reproductive age and in 40s and early 50s. Black women are hit hardest by fibroids, diagnosed roughly 3 times as frequently as white women, and with more severe symptoms. Uterine fibroids are non-cancerous growths of the uterus that often appear during childbearing years. These fibroids develop in the outer portion of the uterus and continue to grow outward. Subserosal uterine fibroids. Fibroids may range from pea to football-sized and even larger. While some women with fibroids don't have symptoms, while other women who have symptoms often find fibroids hard to live with. You can have a single fibroid or multiple ones. In extreme cases, multiple fibroids can expand the uterus so much that it reaches the rib cage and can add weight. Fibroids are generally classified by their location. Intramural fibroids grow within the muscular uterine wall. Submucosal fibroids bulge into the uterine cavity. Subserosal fibroids project to the outside of the uterus. Submucosal fibroids are growing inside the uterine space where a baby grows during pregnancy. Intramural fibroids are embedded into the wall of the uterus itself and are growing inside this muscular wall. Subserosal fibroids are located on the outside of the uterus. This time, these fibroids are connected closely to the outside wall of the uterus. Pedunculated fibroids are the least common type. These fibroids are also located on the outside of the uterus with a thin stem. They're often described as mushroom-like because they have a stalk and then a much wider top. There are several risk factors that can play a role in your chances of developing fibroids. They are obesity, genetics, high red meat diet, high blood pressure, hormones in the body. Common fibroid symptoms are abnormal bleeding like heavy or prolonged periods or bleeding between periods, abdominal discomfort or fullness, pelvic pain, lower back pain, frequent urination or difficulty emptying the bladder, constipation. Some of the complications of fibroids are infertility, anemia, and during pregnancy. Fibroids are also associated with preterm labor, placental abruption. Your doctor may suspect you have uterine fibroids just from feeling your uterus during a routine pelvic exam. If the shape of your uterus feels irregular or unusually large, they may order further tests, ultrasound, MRI, hysterosonography, hysteroscopy, and you to have blood tests to help figure out why you have fibroids. Your complete blood count can help them decide whether you have anemia or other bleeding disorders. Homeopathy treatment for uterine fibroids works very effectively and provides relief from pain and other discomforts. It also restrains further growth of these fibroids and dissolves the fibroids successfully. Homeopathy for uterine fibroids uses natural remedies which are safe and free from side effects. Homeopathic remedies tend to balance the hormones, cure the fibroids, and reduce heavy menstrual bleeding. You can contact Dr. Sheela Homeopathic Healthcare Clinic on 9500049892 for fibroid treatment.